When was the last time you felt you were fully up to speed on the nonstop updates in pediatrics? Let me guess, never.
I think that value has impact. I don't think that it's one or the other, but I think it really is important how you define value. If value is just saving money, then that's not going to help patients and it's not going to help support practices like ours or large practices that are hospital-based practices.
They should land me in the airport they promised to land me after I pay for the ticket. Then there's experience. And I'm not wealthy, so I'm not going to be paying for first class seats to fly from here to Nebraska. I just there's no value. I'm in the same bus. I'm going to get there in this at the same time as everybody else on the plane, but the customer might want extra service, like being in first class, like I want to be seen at 7 p.m. because it's convenient for me, but I'm not willing to pay a dime more for that. I'm going to pay the same as if I was seen at 10 a.m. And I want this clinician, not that clinician, but I'm not willing to pay a dime for that.
And I think that
That's
depends
not
on how the
value.
contract is written. So if you're in a shared savings model ACO and you're not in a all ages ACO, right? Like we are, you're just in a pediatric ACO. Insurance companies are in the business of hiring actuaries and looking at risk. And they are not interested in looking out at risk 10, 20, 50 years because they're looking at their 1 year time frame. And we should be doing more to look at the financial impact of the care that we're giving now and how much money it's going to save into the future. So if I get 75% of my adolescent patients vaccinated for HPV, how much money does that save on the system for all the patients who weren't going to get cervical cancer and anorectal cancer and or pharyngeal cancer, but mostly cervical cancer, right?
It's foolish to talk about shared savings when we're not spending enough to prevent disease.
Yeah.
And so we're just shooting ourselves in the foot.
Why don't we just pay people and reward people for doing what they should be doing? The problem is not paying for value. The problem is that the system is not set up to allow value to push the market for what it actually is worth, right? Because we have these artificial rules. We have monopolies with huge areas of the country that have predominantly one insurer that has a monopoly over the system. Laws in place that say you must provide care in emergency rooms and those kinds of things. Because if my practice is doing depression and suicide screening on every single adolescent 12 and up when they come into the office, and down the street, they said, you know what, that's going to take too much time and that might make us run behind and we might have to see less patients, even though there's a standard, my service is of a higher value than their service. But that's not how we're looking at value. And that's how we should be looking at value.
In our clinically integrating network, we did have shared savings of a good couple of $100,000. You know when that was? During COVID. Our business went down dramatically.
Uh-huh.
Quality was always there. So all of a sudden, it was a great thing.
We're supposed to be doing more well-child exams. You want me to stop doing well-child exams to keep the spend below what you thought it was necessary? And then
So we're valuing the wrong thing. We're valuing the savings. We're measuring the savings, the short-term savings, instead of the long-term benefit to the population and the healthcare system and the health of our country as a whole. What we need in a value-based system is to reward things that are going to get us to a more efficient, less expensive, healthier population. That's why the best model in my mind, if you're going to do employer-based insurance, is direct to employer, right? You pay me to do all the preventative care for your patients. You pay me to do all the chronic care management, chronic disease management. We'll provide behavioral health services. We'll provide asthma services. We'll write prescriptions. We'll do a good job. We'll do their vaccines. And then you can buy a catastrophic plan to cover everything else.
I think if you don't wanna vaccinate, don't bring your kid to me. I don't want the moral I don't wanna worry.
Because the population you serve and all of the external factors that affect that patient's healthcare, whether it's a religious issue, whether it's access to transportation, whether it's whatever that social
Mental
determinant of health
illness,
is. Yeah.
mental
Yes.
illness, drug
Yeah.
addiction.
Employability, financial insecurity, all
Yeah.
of those things affect the success of the physician. No matter what we do as a practice, there's going to be a limit to what we're able to overcome, even if we put a lot of resources into it. And so our asthma rates were through the roof as far as quality, and we were saving a ton of money, and kids were not going to the emergency room. Kids were not going on inhaled steroids.
Should every child born in the US have access to vaccines? That's an ethical question. However, you cannot put a monetary value to the peace of mind that mothers across America have every summer when they send their kids to the pool and they know they're not going to come back paralyzed.
Mhm.
You cannot put a number to the peace of mind of sending your kid, your grandchild, to the pool in the summer knowing they won't come back with paralytic. What if you could take the computer out of the physician-patient relationship? With Freed, you can. Freed is a life-altering solution for physicians, helping you regain the joy of practicing medicine. And if you try to do obesity in your clinics,
Mhm.
it's hard to make money at it because it's
100%. Yep.
it's very labor intensive.
Uh-huh.
So here's where it really gets interesting. Let's start with the ethical question of should every child born in the US have access to preventive care like they do through education K through 12? That includes vaccinations and screening,
Mhm.
and it should be provided by at least office.
It's not a risk, it's a service.
It's an investment.
Yeah,
An
it's a
investment.
service and it's an investment. It's no different than K through 12 education.
We don't need a United Healthcare. We don't need networks. You got a license to practice medicine in your state. That card works at those physicians that are licensed to do that. You ring it, you get that done. We're done.
So and that is where we've gotten into trouble with this whole value-based care thing is the argument on the other side is we don't want to just pay people to churn out more procedures or churn out more interventions and have them not be good quality.
You could go to a membership model,
Uh-huh. Yeah.
Netflix. We can decide if you're on Medicaid, the state pays $40. You, as a physician, you can provide, you can say, I can do it for that amount or I can't do it for that amount. And then the consumer will judge things like, are they open after hours? Can I talk to someone on Sunday? Do they send me to a specialist that costs me more money every time the kid wheezes?
They work from I work for the hospital. I work for the insurance company. I work for the big healthcare system. And so they are really focused on the fiscal year.
Medicaid for all children, which would be a disaster in many ways. But the biggest disaster, the two biggest disasters in the idea of Medicaid as an insurance plan for children is that it competes with people who are aged and really infirmed and
Mhm,
disabled that really need the resources. And the
mhm.
kids don't need that many resources. Medicaid was not built to invest. It was meant as a safety net. If you lump the kids into a program that is not about investing in the future, that works like a payer of last resort,
Mhm,
that is vulnerable to the whims of the last elected individuals,
mhm.
and is short-sighted in the term of years.
What if the three of us were challenged to design a good payer program, value based, whatever you want?
What is wrong with a wealthy society spending 20% of their GDP in
Yeah.
health?
They would give gift cards to Toys R Us for your child if you went to see the doctor,
Yep.
if your vaccines, if you, all these quality metrics. That if you had 4 kids, you'd end up with a good couple of $100. And you know what? People came in.
So I'd rather live in a little apartment where I can afford a maid and a driver and than in a nursing home
You go in the room and do what you do best. We don't care about your opinion. Who has some ethics?
Right.
Business people, they don't have ethics. They do money. It's as simple as that.
Oh my God, it would help so much. Right? Because now you're getting rewarded for doing what you already want to do and you already know is best. Right? And that is the biggest frustration. That's one of the reasons why we have a physician shortage, because we have people retiring early. You don't feel
Yeah.
valued. You don't feel like what you're doing, other people think is important, and you've worked really hard at it. And you keep having people put barriers in front of you to make it more difficult.